Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Evan, an exercise oncology instructor, and today's conversation is on the importance of self checks and mammograms. The information in this video is for educational purposes only, and it's important to consult with your medical team for more in depth guidance and advice. As always, following our conversation today, stick around for some gentle movement. Mammograms and self checks are two crucial tools used in the early detection of breast cancer. But before we learn more about them, I think it's important to first show why early detection is so important. That brings us to this statistic from the American Cancer Society, which states that when breast cancer is detected early and still localized to the breast tissue, the 5 year survival rate is 99%. With this in mind, early detection should be a priority to those at risk. Now, taking a look at some other factors that show the importance of early detection. First off, we know that cancers detected earlier through the proper use of screening tools are usually smaller and localized to the breast, while cancers detected via other symptoms have the possibility to be larger and more aggressive. Looking then at the treatment outlook, we can see that those early detected cancers usually require less aggressive treatment. In terms of surgery, this could mean removal of just the lump or tumor as opposed to some or all of the breast tissue. As for other types of treatment, early detection could minimize or even eliminate the need for aggressive chemotherapy and radiation treatments. Most importantly, detecting breast cancer early leads to not only increased survivability, but also a much higher quality of life throughout treatment. Now that we know why early detection is so important, we can start to look at some tools to help us find breast cancer in its early stages. We'll start by looking at mammograms, which are essentially a low dose X ray image taken of breast tissue with a specialized machine. Patients rest their breast onto the machine, and a plate gently compresses the breast to allow for clear images to be taken. These can be either in 2D, which usually involves capturing images of the breast from multiple angles, or in 3D, where several x rays are taken as the machine moves in an arc over the breast. Mammograms have become the golden standard for early detection of breast cancer as they can detect abnormalities before they can be seen or felt with an accuracy of around 85 to 90%. Generally, it's recommended for all women over the age of 40 to get a mammogram every 1 to 2 years. However, these guidelines can be different depending on your specific risk factors. Generally, mammograms are administered for either screening purposes to check for breast cancer or diagnostic purposes upon the development of new symptoms. Alongside mammograms, breast self exams or BSEs are another tool used to help detect breast cancer in its early stages. They consist of the patient self checking by feeling and looking for abnormalities in the breast, nipple, and armpit areas. It's generally recommended that all adult women perform a BSE once per month. For women still menstruating, this should be done a few days after their period, and for postmenopausal women, this should simply be done on the same day each month. We'll now look at the process for properly performing a BSE, which consists of three phases. Beginning in a standing position, the patient will use three fingers and apply varying amounts of pressure, checking the entire breast and armpit area on both sides, feeling for any new lumps, hardened knots, or other changes. Next up, the patient will move to the mirror in order to visually inspect their breasts, and they'll have their arms rested at their sides, looking for any changes in shape, swelling, dimpling, or any skin abnormalities. Next, they'll place the hands on the hips, firmly push inwards to flex the chest muscles, and check once again. Finally, the patient will perform the final stage lying down, and they'll place a pillow under the right shoulder and place the right arm behind the head. Once again, check the entire breast and armpit area with three fingers using varying amounts of pressure. And this will be repeated on the left side as well, with the pillow under the left shoulder and the left arm behind the head. After performing a BSE, you should always report any irregularities, changes, or abnormalities to your doctor. With both of these tests used for the early detection of breast cancer, it's important to look at them as complementary tools rather than separate tests. In other words, one should not be used in place of the other, rather, they can fill different roles within the overall goal of early detection. Mammograms, for example, can detect abnormalities before they can be seen or felt, but generally are done every 1 to 2 years. This allows BSEs, while not as accurate as mammograms, to be performed much more frequently, providing patients with consistent coverage and awareness. Despite the importance of mammograms and BSEs, there are certainly a few barriers with these tests that are worth discussing. The first of which is consistency when it comes to BSEs. One way to overcome this barrier is to find a convenient time and place to implement a BSE routine, such as in the shower or before bed. When it comes to mammograms, some discomfort with the test itself or anxiety when waiting for results are both very valid. When it comes to these concerns, it's important to talk with your doctors as they can provide you with information that may put you more at ease. Finally, always remember that while discomfort and anxiety are very valid concerns, these are potentially life saving tools that can provide patients with a substantial leg up when faced with a possible breast cancer diagnosis. The good that can come from these tests far outweighs any barriers. Thank you for joining our conversation on mammograms and self checks today. I hope the information we covered has brought you clarity, comfort, and encouragement. Your health and well being are always what matter most, so keep taking care of yourself and holding on to hope. Thank you for tuning in. Now, let's transition into some gentle movement. Today's routine is a sample from our Mapletree On Demand library, available on the Mapletree Cancer Alliance app. Subscribe monthly or yearly to access safe, empowering exercise videos for every stage of the cancer journey. Ready to join? Click the link in the description or scan the QR code on screen.
Hi, I'm Jessica, your exercise oncology instructor with Mapletree Cancer Alliance. This is week 2 of our 6-week program to help you recover from breast cancer surgery. We will continue with some of the exercises from last week to encourage a warm-up for the muscles before we begin advancing the stretches and before adding in any resistance. For this week, it may be helpful to grab a towel, a broom, a cane, PVC pipe, or something similar to help with the exercises. You will also want to find a wall space as well as a chair. Remember, work through the range of motion that you currently have. Find your limit and work to that each time. Never push past your comfort range of motion or push into pain. There may be some discomfort as you begin to stretch through surgical sites, but if you do feel pain, please discontinue or find a previous movement that felt better. You may repeat these exercises every day if it feels good. It may also feel good to do these exercises right after a warm shower, as your muscles are already warm and relaxed. Let's get to it. Start by standing tall in your seats, feet flat on the floor, and shoulders over our hips. Spine nice and tall. And we're gonna start with our box breathing again like we did last week. So this type of breathing can help calm us, can center us, can bring awareness to our breath. And inhaling and exhaling through movements like we have been doing and like we'll continue to do is really good post-surgery for lymphatic drainage and hopefully preventing lymphedema. When you're ready, exhale completely to start. And inhale for 2, 3, 4. Pause. 2, 3, 4. Exhale. 2, 3, 4. Pause. 2, 3, 4. Inhale. 2, 3, 4. Pause. 2, 3, 4. Exhale. 2, 3, 4. Pause. 2, 3, 4. Inhale. 2, 3, 4. Pause. 2, 3, 4. Exhale. 2, 3, 4. Pause. 2, 3, 4. Last time. Inhale. 2, 3, 4. Pause. 2, 3, 4. Exhale. 2, 3, 4. Pause. 2, 3, 4. And release your breathing. Take just a few natural breaths here. And for our first movements, we'll take our elbows to the bottom of our rib cage here. Palms can be face up to start, either with an open hand or in a loose fist. Take an inhale to begin. And exhale, turn your palm face down. Inhale, palm up. Exhale, palm down. Only moving from elbow to hand. Everything else stays steady. Inhale, palm up. Exhale, down. Inhale, up. Exhale, down. Inhale and exhale. Inhale, exhale. Inhale, exhale. One more. Inhale, palm back up. And this time, as we inhale, go ahead and take our arms out to the side. Elbows stay into the rib cage. Exhale, back to center. Inhale, hands out. Exhale to center. Inhale out. Exhale to center. Inhale out. Exhale to center. Inhale. Exhale. One more. And go ahead and keep our arms just like this. As we inhale, squeeze your shoulder blades together with enough force to try and take your elbows back behind you. They may or may not go, that's okay. And go ahead and release. Squeeze your shoulder blades together, bring your elbows back, opening up your chest, and release. Inhale, squeeze together. Exhale, release. Inhale, squeeze. Exhale, release. Inhale, squeeze. Exhale, release. Inhale, squeeze. Exhale, release. One more time. Inhale, squeeze. Exhale, release. And again, keeping our arms just like this, palms face up. As we inhale, take your elbows out towards shoulder height. Palms will come face down. Again, they may not be all the way up here. They might be a little lower. That's okay. Honoring where your range of motion is at today. Exhale, bring your elbows back towards your rib cage. Inhale, elbows out, palms down. Exhale, elbows in, palms up. Inhale, out to the side. Exhale, down. Inhale. Exhale. Inhale. Exhale. Inhale to the side. And exhale. 2 more times. Good, great job. Go ahead and release your arms. Give them a rest, give them a break. Let's go ahead and stand and come to some wall space. On the wall, we're going to work a little bit more on our shoulder and chest mobility and flexibility. It is common to have some tightness in the armpit or the chest area, and hopefully by doing these exercises, we can work through some of that. If it doesn't get better, I would talk to your surgical team. Let's stand a little bit farther away from the wall to start. And let's start with the unaffected arm. Take the fingertips towards the wall and just inhale, walk our fingertips all the way up as much as possible without pain. And then go ahead and exhale, walk the fingertips back down. Inhale, walk your fingertips up. Exhale, walk them back down. Inhale, walk up. Exhale, walk down. 2 more times. Inhale, walk up. Exhale, walk down. Last time. Inhaling up. Exhaling down. And we'll go ahead and switch to the other arm. Place your fingertips on the wall and inhale, walk up as far as you're able to without any pain. Exhale, walk down. Inhale, walk up. Exhale, walk down. Inhale, walk up. Exhale, walk down. 2 more times. Inhale, walk up. Exhale, walk down. Last time. Inhaling up. And exhaling down. This time we'll have the side of our body next to the wall, and we'll turn to the first side that we did, about arm's length away. Fingertips on the wall. Inhale, walking up as far as feels good here. It might be a little bit different than the front. And exhale, walk your fingers back down. Inhale, walk up. Exhale, walk down. Inhaling, walk up. Exhale, walk down. 2 more times. Inhale, walk up. Exhale, down. Inhaling up. This is the last time. Exhale, down. And we'll go ahead and turn around and come to the next side. Fingertips on the wall to start. Inhale, walk our fingertips up the wall as far as feels good on this side without any pain. Exhale, walk them back down. Inhale, walk up. Exhale, down. Inhale, up. Exhale, down. 2 more times. Last time. Release your arm. And if you have a corner nearby, let's go ahead and come to that corner, and we'll have elbows on each side of the wall about shoulder height. If that's too far today, maybe they come a little bit lower. So the forearms are on the wall, elbows touch the wall. And just lean your chest in slightly here. So we should be feeling a stretch in our chest, maybe our armpit area, feeling our shoulder blades close together. And take 3 deep breaths. Gently come back up, release your arms, wiggle them out a little bit, turn them in and out, and we'll do that one more time. Bring our elbows back up towards shoulder height, forearms on the wall. Deep inhale, exhale, lean your chest in. Inhale, come back up. Release your arms. Give them a little wiggle, a little shake. This time, we'll take one palm to the wall, and our opposite arm will come to our shoulder. If it feels okay, gaze out past the shoulder. Few breaths here. Inhale your head to the wall, release your arms. And we'll take our other palm to the wall, opposite hand to opposite shoulder. Stay here, or deep inhale. And exhale, gaze out over your shoulder, over the bent arm. Inhale, head back to the wall, release the arms, and we'll do that one more time. Take your palm to the wall, hand to opposite shoulder. Stay here facing the wall, or exhale, gaze out over your shoulder, over the bent arm. Inhale back to center and exhale to the other side. Inhale to center, exhale, release. We'll take both of our palms to the wall, around about shoulder height here, and step back a little bit. So we should be leaning up on the wall, maybe feeling this in our core, in our arms for this wall plank. And if this is where you're at, you can stay here, or we're gonna be doing some shoulder taps. Take your left hand to your right shoulder and back to the wall. Right hand, left shoulder, back to the wall. So opposite hand, opposite shoulder. Left hand, right shoulder, back to the wall. Right hand, left shoulder, back to the wall. Good. And switch. A few more taps here. Continuing to breathe. Slow and controlled. Just a few more, almost done. And one more each side. Gently press off the wall and release. We'll come back to the chair for this next one. And again, we'll start with your unaffected arm. We'll take it just gently on the back of your chair and bend into your knees. So we're not putting any weight on this arm. It's just here for balance and support. Hinge at your hips just a little bit and let your opposite arm hang heavy. So our muscles are not doing any work here. And just gently swing your arm forward and back. Just small movements to start. And if this feels good, maybe we see how it feels to gently swing from side to side. And if this is still feeling okay, maybe we take our arm around in a circle, remembering to let our muscles relax as much as possible. Let your arm dangle. And if we're going in a circle, let's switch directions. Inhale, come back up, and we'll switch sides. Let your hand rest on the back of your chair, bend into your knees, hinge at your hips, and let your arm hang heavy. When you're ready, gently swing forward and back. And if this feels okay on this side, maybe we start swinging from side to side. Muscles are relaxed as much as possible. And start bringing our arm around in a circle, maybe small to start. See how that feels. And then switch directions if we're doing circles. Inhale, come back up. And we can use a wand or a rod, a cane, or that pipe if we have it for this next one. Totally optional, so we don't have to. If we do have it, we're going to take it behind us and palms face behind. Inhale as we gently squeeze our shoulder blades together, arms come behind us, and release back down. Inhale, bring your arms behind and back down. Inhale, bringing them behind, chest is open here and back down. Keeping in mind there should not be any pain. So going as far as feels good for you today. Just a few more. Two more. Inhale behind you and exhale, release. Last one. Go ahead and release this from behind you. And if we are using something like this today, then keep it close by as we come back to our seat. If we're using a wand or a rod, we're going to take it in front of us with palms facing down. If you don't have this, then just do it with palms flat. We're going to start with this resting behind our knees. And inhale, bring our arms up towards shoulder height. Elbows stay straight. Exhale, release back down. Inhale up. Exhale, release. Inhaling up. Exhale, release. And as with all of our movements and our stretches, going as far as your body will allow for you, never pushing past that point, even if we want to. Listening to our bodies, not pushing into any pain. One more time. Go ahead and release this, and we can put this off to the side. Finding our seat again, sitting up nice and tall. Inhale, squeeze your shoulders towards your ears. Exhale, release back down. Inhale, squeeze to your ears. Exhale, release down. Inhale, squeeze. Exhale, release. Inhale. Exhale. This time, inhale, take your shoulders up towards your ears. Exhale, roll them down and back your spine. Inhale, up towards your ears. Exhale, roll them down and back. Inhale, up. Exhale, down and back. Two more. Inhale, up. Exhale, down and back. Last time. This time, inhale, shoulders towards your ears. Exhale, roll them forward and down. Inhale, up. Exhale, forward and down. Inhale. Exhale. Two more times. Go ahead and release. Take a deep inhale. Exhale, turn to look over your right shoulder. Exhale to the left. Inhale to the right. Exhale to the left. Inhale to the right. Exhale to the left. Inhale back to center. And this time, as we exhale, take your ear to your shoulder. Feeling a stretch in the side of our neck here, if that feels okay. Keep the shoulder down and away. Inhale to center. Exhale, opposite ear to shoulder. Inhale back to center. Exhale, ear to shoulder, and stay here. Or if it feels good as we exhale, let's start taking our chin towards our chest. Moving very slow here, maybe taking this half neck circle all the way around to where our other ear comes to our other shoulder. Exhaling down and around, stopping anywhere that might feel good, and take our ear to our other shoulder. 2 more times. Inhale back to center. And we'll work into our spine just a little bit here. Inhale, arch your back, open up your shoulders, maybe your throat. Exhale, round your spine. Inhale, open up. Exhale, round. Inhale, open. Exhale, round. Inhale, open. Exhale, round. Inhale, come back to your seat. Thank yourself for showing up to do this for yourself. Thank you for joining me, and I'll see you next week.